anyone else in the home also smoking?
Sorry, doctor?
Anyone else in the house also smoking?
No, doctor. Me and my friend, we are living in the house, so we are both are smoking, doctor. Other than no one at my home, and no one.
Okay, okay, right. Okay. Any, so you have any long-standing disease?
Doctor, I don't have any problem.
Any regular medication?
No, doctor.
Okay, okay. Any long-standing disease in the family?
No, doctor. I just told my father I had a heart attack. That's the
Hmm.
reason
Hmm.
he didn't survive actually, doctor.
I'm so sorry to know about your loss, Mr. Ali. Mr. Ali, how's your daily diet?
Well, doctor, I'm cooking myself, so I like to cook beef most of the time, red meat.
Okay, red meat you are taking. Right. Okay. And do you do exercise?
Yes, doctor, I go gym.
That's great. Okay. And what
Hmm.
do you do for a living?
Doctor, I'm working in a bank.
How the things at work?
Uh, Stressful, doctor.
Yes. Okay. Might be difficult for you and quite challenging for you. And what's idea, your plan or idea? May I know for the smoking?
Good thing, doctor, you asked me. I don't know, it's bad for me, especially as I told you my dad's history, and I read on Google also. So that research paper also. So I don't know, I don't know it's bad for me or not. So I tried my
Hmm.
best.
I really
But doctor,
appreciate your decision.
I'm
Yes.
worried that I will not manage that craving, doctor.
Yes, no problem, no problem. We have the very specialized, especially teams, and we are here to help you. Nothing to worry about that. Okay. So, and how about what's more specific concern other than like
Doctor,
as you mentioned?
I'm concerned about my craving because I tried twice, doctor, and it is really hard for me to, stay on it.
Mr. Ali, any other recreational drug are you using?
No, doctor, I never use anything.
Hmm. What do you expect from me other than this and the for the recurrence and the sedation quitting? Anything else specific?
Just doctor, I want help with something stronger than that. Just willpower, maybe tablets, or
Hmm.
maybe some your. I need as a medical professional your support, doctor.
Yes, I understand. How does it impact?
Well, doctor, it is impacting me a lot. I sustain the finances, guilt about smoking around the children, and because I have been building a lot of children are there. Okay, so I have guilt on that one. Worry about long-term health problem, as I told you. My father is free.
Hmm. Okay. I want to sum up, Mr. Ali. You came here to discuss about the quitting smoking as you have already tried, and you want from me your concern about your father's health you have seen, and you want from me if we can help you regarding the this stop reducing the craving. Is this all, Mr. Ali?
Yes, doctor. Yes,
Okay,
doctor.
thank you. Thank you for sharing your concern, Mr. Ali. First of all, is you have tried already, but I want to discuss you in the detail. If
Mm.
you are planning for quitting smoking, first you make the plan, and 1 week or 2 weeks before, from this date, I will not take smoking. I will start quitting. Okay.
Mm-hmm.
So first of all, few things you have to manage. I will give to just advise you, like remove the lighters, ashtrays from the room.
Mm-hmm.
Is it okay? Can you
Mm-hmm.
do this?
I
Okay.
can do it,
And if
doctor.
Okay, and how about your friend? If you just also involve your friend, maybe he will be also like encouraged from your decision also. If he can also stop the smoking, either you
Well,
can ask him if he can go out, like at least avoid smoking in front of you.
yes, doctor. I will do it because I never thought of this one. Thank you, doctor, for
Ne-
mentioning me, doctor.
Never like I would like to involve your friends, colleague in your decision. They will really help you. You will get positive thoughts from them. At least
Mm-hmm.
either you avoid the outing or gathering with other people or smoking. This will be best for you. And
Mm-hmm.
I would like to advise you 5Ds, especially 5Ds means like delay. If you are feeling anytime the craving for the smoking, you just try to involve with the other thing, distract yourself, whatever you like. Any movie, any chatting. Just
Mm-hmm.
actually this craving stays for a few minutes, 5 to 10 minutes.
Mm-hmm.
Then you will
Okay,
forget.
doctor.
and
Okay,
stay
doctor.
determined. I will really
Mm-hmm.
appreciate you came and you looks determined to me also. And drink
Mm-hmm.
water, whatever you do other things, involve yourself.
Mm-hmm.
Actually, these things well before patching and the gum, as you have tried the patches, we always prefer to try patches with the gum also to combine. But
Mm-hmm.
before trying patches, I would like just if you can quit yourself. I'll give you leaflet also. It's a very detailed.
Okay,
Uh,
okay, doctor.
we we miners, our team are all through with you whole of the journey.
Okay, doctor.
Okay, try to do exercise, deep breath as you are going the gym. So it would be better for you. Just involve whatever you like, swimming, sports. Try to
Mm-hmm.
sit with the positive people. Avoid
Mm-hmm.
like where the others people are smoking in the crowded
Mm-hmm.
places.
Mm-hmm.
This craving will be will be reduced within a minute. Okay.
Oh, okay.
Okay.
Mm-hmm.
First of all, if these things not working, no problem. We have better option also. We can apply the patches. Okay. Next step. But I don't
Mm-hmm.
recommend now. Next step. There is the patches option. You have to apply in the morning and remove in the
Mm-hmm.
night time. It may cause some irritation in your skin. Okay.
Okay, doctor. Yes,
Okay.
doctor.
But still after the patching, if you feel craving, there is a gum also there.
Okay, time up. Well done, Dr. Saira. Wonderful. It is excellent approach from your side. I don't have to add some many things because you covered each and every scenario. The agenda of this case, how to recognize that, how to take off the craving. That was the main thing that you catch it, and I must say, it is not that easy that patient who already stopped smoking and tried the patches. So here, patient agenda was to do the sign posting, structured cessation services or something. But since we don't have this kind of services, so we have to do from our side. So we have to setting a quit date, identifying the triggers, copying the strategy. That's for our plan. And yes, of course, if you are giving the patches, so if you are giving the patches and if you are not telling that you have to remove at the night time, you might fail this scenario. Okay, so you did a good job that you told them you told that you mentioned that okay you have to remove this one. Okay, yes, contraindication was remaining for Dr. Saira. So please speed up your things. Okay, otherwise it is clear pass the exam. I don't have to add anything.
Doctor, in
So
relation with the red meat, should I need to add anything? Like pigment
Doctor,
paste or anything?
increase vegetables. You have to increase the
Hmm.
vegetable if you're
It was
taking
in my
that red
mind
meat.
to
If
say.
yeah,
Yes.
exactly. So the thing, if someone is taking that one, so directly you cannot distract. Directly you cannot stop until as patient having that such much harm on that one. Okay. So
Hmm.
yeah.
Okay,
So
thank you, doctor. Thank you.
Dr. Sarah, you are the next. Your next case is give
Dr.
me one
Munir,
second.
sorry, I'm sorry. Just 1 minute.
Yeah.
Dr. Imran, sorry.
Yeah. Yeah.
Dr. Imran. And what about pharmacological treatment? Did she tell the
And
patient about
because
what?
yeah, she told about the patient. First, she told that we will be trying with non-pharmacological because he is having craving issues. Okay, so craving issues are there. He already tried the patches. So in that scenario, what you have to do it first, you have to go with his willpower and how he can go with how strongly he can trust himself. So that was the main agenda of this case. Okay, it was not something that patient need through and through. If your patient is not taking this an NRT, you can go with the Varnasalane or whatever. So on. No,
Yes.
there was some there. Yeah, because that what you call it. Uh, Management in the management pharmacology options are there. NRT patches, gum lozenges, inhalators are there. Even though one is saline and bupropion, depending on local availability. Okay, but now let me
Mm.
tell you, in this our TP level, so we will be going with certain levels. Okay, patient already
Okay.
tried twice, one by his willpower, one by the patches. Okay, only the thing she must forget to ask what kind of patches he tried, what kind of patches he tried actually. Okay. Otherwise,
Yes.
yeah. So that was not the other thing that she have to lose the case. Yes, she have to clear this case. The reason because she follow the steps.
Okay.
Patient centered. One thing, not judgmental. Patient. She was taking patient thoroughly in the plan. Okay. She was not just going with some sort of doctor centered issues. Okay, Dr. Saira, your patient is 32 years old, Mr. Rahman. Come to discuss his problem with you. Take proper history, examination, manage the patient.
Okay.
Okay, doctor, give me one sec. Okay, start.
Good morning, Mr. Rahman. I'm Dr. Sarah here. How can I help you?
Doctor, I've been coughing for about 6 weeks now.
I'm so sorry to know about your cough, Mr. Rahman. Can you tell me more?
Doctor, initially started dry, now it's a productive of small amount of yellow sputum. Sometimes there is a streaks of blood I'm getting. I'm scared of doctor this blood.
Yes, I can understand your worry, Mr. Rahman. Okay, since last 6 weeks, any fever is there?
No, doctor, on and off I used to get the fever mainly in the evening.
Mm-hmm.
But whole day I'm doing good, doctor. I don't have any problem. Maybe I'm tired, the kind of stuff I have to.
Mm-hmm.
Um, my job is like this, doctor. So maybe because of that one.
As you mentioned, your job is like that. May I know what type of job, Mr. Rahman?
Doctor, I'm a construction worker.
Mm-hmm. So where do you live?
Doctor, I'm living in a labor camp.
Okay, all right. So anyone else has same symptoms?
You mean to say cough?
Yes,
In
like
my
similar. Mm-hmm.
in my room, no one, doctor. But I went back to my country, Pakistan. So my auntie have was she was coughing actually. I remember. Yes, I do remember. It was doctor almost 2 months ago, doctor.
2 months ago. Okay, all right. Okay, other than this cough and the fever, as you mentioned, any weight loss?
Oh yeah, doctor. That's the big issue for me. I lost almost 6 kilo of my weight without trying anything.
Mm-hmm. Okay. Any back pain, Mr. Rama?
No, doctor.
Any urine problem?
No, doctor.
Okay. Okay, right. Okay, Mr. Rahman, any long-standing disease you have?
No, doctor.
How about any regular medication?
No, doctor. I don't take any regular medicine, doctor.
And any, okay, long-standing disease in the family?
Huh?
Long-standing disease in
No,
the family?
no, doctor.
Okay, do you smoke?
No, doctor.
Okay. Any chest pain, Mr. Rahman? Sorry, I forgot to ask.
No, doctor.
No chest pain. Okay, do you drink alcohol?
No, doctor.
How's your daily diet?
My diet is good, doctor, but nowadays I don't feel hungry.
Mm-hmm. Yes, I can say. Okay, Mr. Rahman, as you told, you work in the construction and their labor company, and you live with them also. And any stress going on?
Well, doctor, stress is there because I'm building new house and my town, so I have to pay a lot of loan. That's it, doctor.
Mm, yes, might be difficult for you, Mr. Challenging for you, Mr. Rahman. What's the idea behind this?
Maybe doctor is TB because I told my aunt back home got this, so maybe I'm the one next.
So your aunt is already diagnosed with the TB.
Yes, doctor.
So how was she? She was taking medicine.
She was taking medicine. Unfortunately, she was admitted 3 days ago to hospital because of this problem.
I'm so sorry to know about her. Okay, so even she was under treatment.
Yes, doctor.
Okay, and what's concerning you more?
Doctor, I'm scared that if something serious like cancer or something because of the TB, like my aunt got, maybe I'll be suffering. I'm living abroad,
Hmm.
doctor, alone, so it's very difficult for me, doctor.
I hope so not, Mr. Rahman. We'll do best to help you. And what do you expect from me?
Well, doctor, I want to know what is this actually? If it is
Hmm.
contagious, how can do it? And is there any treatment? Because my anti-treatment didn't work, so I'm scared that it will not work on me.
No problem. I will discuss this particular issue with you. How does impact on daily life?
Uh, well, doctor, I'm too tired to work full days. Colleagues have noticed this weight loss, and
Hmm.
people are not don't want to sit with me because of my continuous cough, doctor.
Mm-hmm. Okay, I want to sum up. You have last 5 to 6 weeks is a cough and fever, night sweats, as you mentioned, also weight loss, and your concern maybe that some lung cancer, some serious condition, and you want some medication because people are even already you have noticed people are avoiding you. Is it all, Mr. Rahman? You want from
Yes,
me the
doctor.
medication. Thank you. Can
Yes,
I
doctor.
examine you
Yes,
now?
doctor. Okay, go ahead, doctor.
Okay, with the proper privacy of chevron, I will sanitize my hand with the alcohol, and then I will check your pulse, look at your hands, nails for clubbing, and I will check your blood pressure, oxygen saturation, eyes, oral cavity. I will check. I will check
Mm-hmm.
nasal, nose, and lumps and bumps in the neck. And can
Mm-hmm.
you please unbutton your shirt? I will look,
Mm-hmm.
feel, touch your chest. I will listen to
Mm-hmm.
the lungs. Okay, from apices to the basal to the apices, and then I will do percussion. Okay, and listen to the lungs and check the feet also.
Okay,
Anytime
examination
you can,
finding. No, doctor.
anytime you can. Okay.
Okay, examination finding temperature 37.9, heart respiratory rate 18, heart rate is 96, blood pressure normal, SpO2 96 on room air. Generally thin, mildly cachectic patient. Chest reduced breath sounds and crackles in right upper zone. No clubbing, no peripheral edema, lymph nodes small, non-tender cervical lymph nodes palpable bilateral.
Hmm. Okay, Mr. Rahman, I want to do some investigation for you. Is this all right?
Okay,
To
go ahead,
confirm my
doctor.
diagnosis. Yes, I want to do a chest X-ray and the sputum for your culture. Sputum, FB sputum, 3 morning samples with the culture also. Okay, and the
Hmm.
PCR.
Okay, doctor.
Okay, and once the report come, Mr. I'm
Anything else,
sorry,
doctor?
anything else? PCR, sputum, and urine test also. I will prefer. Okay, cough is
Anything else,
there.
doctor? Anything else, doctor?
Lymph nodes biopsy. I will check the lymph nodes. Cervical lymph nodes are there.
Anything else, doctor?
PCR, gamma interferon test,
Okay,
and
chest X-ray, right upper lobe infiltrate with cavitation. Sputum microscopy shows positive for acid fast bacilli time 2. Okay, sputum culture and sensitivity pending. And HIV test not done.
HIV. Oh my God. Yes. Sorry. Yes. Okay. Mr. Rahman, from your history and examination, what you have know that you have condition called infectious tuberculosis, like we can call is tuberculosis. Is actually bacterial infection causing the infection of the air sacs of the lung tissues. Okay, so nothing to worry about. As you have already seen your aunt, I can understand your concern. It's a good thing, Mr. Rahman. You came here. It's a quite treatable condition. I don't know
Mm-hmm.
about your aunt, what was the complication, what was the actually the scenario. But
Mm-hmm.
for your side, let me assure you, it's a quite treatable condition. We are with you whole of the journey of the treatment. Is it
Okay,
okay? It's
doctor.
quite
Oh,
satisfactory. Okay,
okay,
thank you,
doctor.
Mr. Rahman. So, Mr. Rahman, first of all, I will refer you to the specialist. There is a treatment I want to discuss with you. This is nowadays for TB we have 4 months of the treatment. Is a like lesser duration like before. It's same
Okay,
similar
doctor.
effectivity. Okay, so we will start the medication of isoniazid, rifampicin, monofloxacin, and parazinamide. Okay,
Doctor,
okay.
I'm very bad in taking the medication. So, is there any way that will help me to?
Yes, Mr. Rahman, this is nothing to worry about this. I will want to involve you in the dot therapy. There is some organized, authorized person will come every day to make sure you are taking medication. He will take care of
Okay,
you the
doctor.
best.
Oh, really,
Okay.
really great, doctor. Really great,
And,
doctor.
and one more thing, Mr. Rahman, I want to tell you, you have to isolate yourself. We will involve your company in the because we need to contact tracing of the other people also. Is it
Mm-hmm.
okay? Okay, and you
Okay,
have
doctor.
to isolate for the 2 weeks. Okay, once the
Okay, doctor.
report, your PCR report will comes, according then we will decide also. We will take your
Okay,
sample
doctor.
again also after 2 weeks.
Okay, doctor.
Okay, but nothing to worry about it. Your room should be well ventilated, and I would like to like inform we will like take care of your diet. Diet should be very healthy, especially
Mm.
fruits, more protein diet because I can see your weight is also reduced. Are you
Okay,
with me,
doctor.
Mr. Rahman? So we will
Okay,
give you
doctor.
healthy light. And as I seen, you have seen little bit difficulty in the cough. Also, nothing to worry about it. We can involve in the pulmonary rehabilitation program also. They will show you small exercises with your cupping hands. It will help you to resolve and to take out your sputum. Is it okay?
Doctor.
Okay, and nothing to worry about that. We are all whole of the journey. We are with you. Any severe blood weight loss and too much cough, fever, night sweats, blood in the sputum, come to contact with us anytime at earliest.
Okay.
Okay, and
Okay, doctor.
definitely for the
Time up. Dr. Sarah, well done. Let me answer one more thing over here, Dr. Ma, Dr. Sangeeta. Please don't talk don't mention anything in the chat regarding the case going on because it might distract that candidate who is performing. Okay. Second thing, LFT, if you are telling that it will be overutilization of the resources because there is nothing involvement of the LFTs. Okay. So first you're going to diagnose. After that, you're going to do it. Okay. So once you've done, then for when you start a medication, that time you can tell that I'm going to do such and such thing. Okay. But you
yes,
cannot
yes,
say that
doctor.
I'm going to
Even
do
I have to
LFT.
tell the side effect. I was just thinking the time of
Yes,
yes,
okay. But HIV test is mandatory. If you are not telling HIV,
yes,
it will
yes,
be a negative marking, okay, for that one.
yes, right,
First of
right.
all, explain the diagnosis, immediate steps, and treatment led by the TB team, like say DOT programs or whatever, so on, because Pakistan, India, Bangladesh, there is some sort of, important part is that one you have to tell this in mandatory way. Okay, that DOT program and assess and support psychosocial needs. Okay, as he was worried about and contact tracing done by Dr. Saira. So well done. So apart from
Thank
this
you,
one,
doctor.
doctor, yes, doctor.
Dr.
So no,
Imran?
doctor, don't be sorry, doctor. It's okay. Yeah, doctor, tell me.
Yeah, as you asked the doctor about the multiple drugs, so she could tell you that you can take in combination or
She can explain a combination until unless if you're telling in a proper way. First thing you have to tell the drug names in OSCE exam. You have to tell the drug names, okay? Because the examiner want to know about the drug names, what for 4 months and what is 2 months and what is 2 months, okay? Second thing, if like say 6 month treatment is there, then you have to tell about the thing how the examiner want to listen because the examiner want to listen about the drug names and side effects if any. Okay, before ruling out anything, so you have to ask about eye issues or you have to ask about patient, abdominal as he inquired. So if she inquired abdomen and she forgot to ask about eye or the other thing, it's pretty fair enough. Okay, so there is no such harm.
Dr. Imran, you asked the doctor that it's multiple drugs. How can I take it? So apart from the dot, we can tell the patient that it comes in combination also.
Yes, doctor. But he said I'm very bad in taking medication. Bad in taking
Okay.
medication, I'll tell you because there is one scenario I will tell you, give you guys that later on because that scenario is very precious scenario. I got in my orientation program. They're given in our mock by the examiner, that MRCGP examiner. So here that agenda is that one how patient come with the problem only that patient say that I'm very busy. I don't take the medication. Patient will keep on saying this thing. So now patient wanted to know, is there any shortcut of any kind of medication is there or not? For example, um, maybe you can give dual combination. Well, you well said that one. You can say a patient don't want to take vitamin D tablet, for example, for daily basis, okay, or weekly basis. So you can offer injection monthly once. Okay. Or patient is scared of injection, you can offer tablet form. Patient taking 4 tablets are there, you can give combination drug like say in chronic patient like say diabetes and doctor this diabetes and hypertension. So there are multiple ways are there, doctor. So agenda of the case, uh, mostly the patient will tell you in his concerns and his idea in his concerns mostly he will be telling you. In this patient's concern, there was nothing such thing. Patient concern was totally different. Yes, you are right. Here, he raised the question over here when patient doctor was giving the medication. He just mentioned that I'm very bad in taking the medication. Bad in taking medication means maybe he forgot to take the medication. You understand what I mean, doctor? So,
You mean,
yeah,
doctor,
Imran,
that
compliance? You mean compliance?
Yes, Dr.
Yes,
Imran,
compliance. Yes,
compliance.
yes,
It was
yes,
compliance
compliance.
issue.
Okay,
Yeah.
Dr. Imran, I want just two questions. One is DOT is I think abbreviation, direct
Observation,
observation treatment.
observation. Yes.
Direct observe. And one thing more, this DOT program, daily basis will come person to make sure that he took the medication or not, or twice weekly.
Doctor, this is based on, again, I'll tell you, this is based on local settings. This is not, it is not general setting, it is a local setting, okay? It is not,
Okay,
it is not uniform all
okay.
across.
And one thing more,
Dr.
when the
Imran, I
Dr.
want to
Sara
ask
told
that
us that about the ATT, this is the
Hmm.
now this is the updated 2021 by the
Hmm.
WHO. We can say like this, and we can mention the name, or we can say the previous treatment. Like
No,
now she
like say,
told
no,
isoniazid, rifampicin, and moxifloxacin with
yes,
PZA, pyrazinamide.
yeah,
And
yes.
2 month, there are 2 month for all, and
Rifampicin,
2 months to
not rifampicin, doctor, rifampicin. Rifampicin is
rifampicin.
not there. Yes,
Rifampicin. Okay,
yeah,
rifampicin is a generic, I think so.
yeah,
Rifampicin, I don't know. Okay, so we can say 2 months you can take all the medicine, and 2 months remaining. 2 months I don't
yes.
know. Three
Okay,
drugs they can take.
Dr.
okay.
Imran,
If
old regime is no more required to detail
No,
ask
no,
all.
doctor, there are two things are there. Let me tell you. In this scenario,
Pregnant.
many people are getting confused. Let me tell you. This is a long-term medication. Somehow patient are scared of that thing, okay? The agenda to make the patient comfortable and compliant to the medication. They should not skip the medication. We can tell in a way, Mr. Khan, look, you had tuberculosis positive, okay? Now it's not like as previously you used to take 6 tablets for 9 months or 6 months. There are some other new drugs also there, which we have lesser medication and lesser time. How does it look like? How sound how you feel to how you feel? Is it okay for you to start, or you want to take the medication as per the old style? Okay, one thing. Second thing you can say, Mr. Khan, look, there are two things again. One treatment based on 4 months for 2 months, 2 months medication. One treatment is 4 months and 6 months, 2 months. Okay, so I think 4 and 6 month said 6 month treatment doesn't fit in your criteria. How about taking about this medication? Your about 4 months, so patient will be happy. Yes, Dr. Nadia, you very well said, doctor. That one it's better to say the previous regime as still previous local guidelines. But doctor, examiner want to listen now new guidelines, doctor. Dr. Nadia. Okay, so you have to understand now new needs also because examiner want to listen that how you are pampering the patient actually. Okay,
Sorry,
so
Dr. Imran, one more question about this one. Just that HIV, you say, is it mandatory to
No,
ask?
no.
And like,
yes,
for
doctor.
example,
Yeah, yes, doctor.
your case of pregnancy with tuberculosis,
Uh, no,
did you ask in that one also?
yes, doctor. We did ask. Okay, patient came in my case. Patient came with two samples. Sorry, AFB sample positive 2 times. Okay. Okay, patient came with two samples positive. Okay, so in that scenario, without wasting the time, I started the medication. I told that I will run few investigation. When I said X-ray, now to X-ray, she's a pregnant lady. I told, don't worry about that your baby. There will be no harm of that one. I'm going to check the X-ray about any complications going on in your lungs. To see that one, we will be providing you a abdominal shield, okay, to protect your baby. So that was the agenda, that if like say you're not mentioning that you're going to do the x-ray and you didn't mention about that shield, so again you lost the case because you have to talk about your baby safety also. Yes, Dr. Nadia, it was pregnancy old regime always. Okay, doctor, she is there. Sorry. Yeah, sorry, doctor, I didn't put
Doctor,
the name.
yeah, Dr. Imran.
Sorry. I put the name from there.
Okay.
Okay, your patient, yeah, doctor, your patient is Mrs. Aisha, 29 years old, come to discuss a problem with you, take proper history, manage the patient, examination. is not required.
Okay.
Okay, give me 1 sec, doctor. Doctor, I will don't worry. I will be giving that all management outline for this tuberculosis for you all because this is a main case for everyday scenario, everyday exam case. Okay, so I will be giving all scenarios to you guys. Don't worry. Okay, so start.
Hello, good afternoon. I'm Dr. Musar, today's GP in the clinic. Mrs. Aisha, how may I help you today?
Doctor, I'm worried that my husband been coughing for months, and we didn't know that it was TB until last week. Now, doctor, I'm a bit scared that I might got the TB.
Okay. Can you please tell me more about your concerns?
Doctor, I told you that my husband was keep on coughing since many weeks,
Hmm.
and so initially it was dry, then wet. Then recently he went to the doctor last week, and doctor diagnosed him he's a TB. He's a tuberculosis positive. They started the medication. Now worried about my child and about worried about myself, doctor, and a really scary situation for us. Maybe, doctor, I will die because of tuberculosis.
No, I hope not. Just few more questions, and then I'll be telling you about complete management or anything your concerns. Okay.
Okay,
So,
doctor.
how many people live at home?
Doctor, my 3 years old son and
Hmm.
my husband and me, doctor.
Okay. May I know since how long he was coughing? How
Doctor,
many
he was
months?
been coughing almost 3 months actually. We haven't noticed. And when I when went for shopping and we check his trouser size, it become smaller. So then
Mm-hmm.
I got worried. Then I took him to the hospital
Okay.
and they said he might have some sort of problem. So they check and they found out he is having tuberculosis.
Okay. So, do you have an idea from where he got it?
Doctor, he is a social worker.
Hmm.
Okay, and he's working in slum areas. So maybe from there he
Okay.
got.
Okay. So he's taking his medications on time, or there is any program who's connected to him?
No, doctor, the doctor teach me this thing. Okay, and the doctor
Hmm.
didn't mention about me anything, and he teach me that how to give the medication. So I'm really giving on time with my alarm setting, doctor.
That's great. All right. So, Mrs. Aisha, do you have any cough,
No, doctor, I don't have cough.
any fever,
No, doctor.
any chest tightness?
No, doctor.
Okay. And how's your baby doing? 3-year-old son. Is he having any cough?
Occasional cough. He's also having occasional cough. Recently, he had a viral infection. We went to the doctor and they said this is a viral
Mhm.
infection.
Okay. All right. So where is your son right now? Did you bring him also?
And doctor, he's in the car.
Okay. I'll be looking at him in a while also. Okay. So, Mrs. Aisha, just want to know what do you do for a living?
Doctor, I am a teacher.
Okay. And are you going these days to school?
Yes, doctor, I'm going to school.
And which class you are teaching?
Doctor, I'm a nursery, teacher.
All right. And okay. So, and do you have any past long-standing illness
No, doctor.
in your family? Anybody have the similar condition?
No, doctor.
Okay. And do you smoke?
No, doctor.
Do you take alcohol?
No, doctor.
How's your diet these days?
Doctor, diet is now not good actually.
Okay.
That's another big headache.
Okay. Okay. And how's your when is your last menstrual period?
Doctor, maybe next week I'll be getting.
Okay. Is it regular or are you planning for a baby?
No, doctor, it's regular, doctor. I'm using this medication, doctor, for COCPs.
Okay, okay. And what do you have an idea like apart from this concern, is there anything else that's on your mind?
Doctor, I might have caught TB without symptoms, doctor.
Okay, we'll be talking about this. And what do you have concern in particular?
Doctor, what about my child? Could he get very
Mm-hmm.
sick if he got a TB?
Okay. And what do you expect from me today?
I wanted to know, sir, what test can we can do it, and how to know that whether we are safe or not.
Okay, so let me sum up, Mrs. Aisha. You work as a teacher, and your husband got TB a month back, and he's getting treatment since 1 week now. And you're concerned
Yes,
about
doctor.
your baby, and you want some investigations to rule out if you're having the same condition. Is that all?
Yes, doctor.
Okay, I just want to run some blood investigations for you. Is that okay with you?
Okay, doctor. What you want to do, doctor?
I want to check your CBC, CRP, ESR, and also chest X-ray,
Mm-hmm.
along
Okay.
with Montox and
Okay.
IGRA.
Okay. What about my baby, doctor?
Yes, I will be looking at him. Do you want to bring him right now?
Yes, doctor. I
We
can
can,
bring within 1 hour. I can
yeah,
bring. So what you will do, doctor?
yeah. I want to run I want to check his chest X-ray. Okay, only
Okay,
chest X-ray
doctor.
I'll be doing. Okay.
Oh, okay. Okay, doctor. All investigations pending, doctor. Go ahead.
Okay, so Mrs. Aisha, since you talked about your husband and your baby is 3 years old, there's few things I want to talk about in your management plan. Is that okay with you?
Yes, doctor. Go ahead.
Until and unless your results are pending, I will not be starting you on medication, but is probably I'm starting your son on the medications since he's under 5 years old. So and he got into contact with his dad, so he might
Mm-hmm.
be having the TB. But since you told me he's having cough, might be he got exposed to the TB also.
Mm-hmm. Okay, doctor.
Okay,
Mm-hmm.
all right. So so I am going to give him the medication
Mm-hmm.
daily on the daily basis. It will be for 6 months, okay, isoniazid according to his weight.
Mm-hmm.
Okay, and I know it's somehow difficult for you to think like it will harm the baby, but still it's a prophylaxis. Even though he's having any kind of infection, meanwhile we are catching him on the earliest as soon as possible.
Mm-hmm.
Okay, so since your results are pending, there are few precautionary measures I want you to do at home. Please try to isolate your husband. How many rooms do you have at home?
Doctor, I have one room only.
And how is the ventilation at home?
Doctor, ventilation, we have only one window, doctor.
Okay, but Mrs. Aisha, please try to have a good ventilation at home. Please try to take care of him and your kid. But if it's possible, make a partition in the same room. Ask him to cover his face, and if he's coughing, try ask him to try not to be close in contact with the baby. Even though we are starting him on medication, still it's still possible. Try to isolate him and no more contact until the treatment is over and until the results are negative. Okay,
Oh, okay, doctor.
and please not to worry about that. And most importantly, you are a teacher and you being engaged with the students in the nursery school. I am afraid that anyone got, if you are infected, anyone might have gotten it from you also. So I'm writing a letter to the school authority. So if it's possible, they might be the kids might be screened like the chest X-ray. It is necessary for all of them to be done. Okay.
Okay, doctor. So all will be needing, all need X-ray, doctor?
It depends on how many people you have contacted in this 1 week.
Okay, doctor. Anything else, doctor? So what kind of diet I can, doctor? Diet I can take?
Please take more balanced diet and have stay hydrated.
Hmm.
Okay, and more protein
Hmm.
in your diet. Try to have more ventilation at home. Try to keep yourself precautionary measure. And if you feel cough and any any chest
Okay,
pain or
doctor.
any fever, please present to me as soon as possible. Okay.
Okay, doctor. Okay, doctor.
I'm also Yeah, since you are not connected to dot therapy, but if you still you need, please let me know.
Okay, doctor.
Is there anything
So,
else you want to know?
no, doctor, that's it, doctor.
Okay. Thank you
Okay,
for
okay,
visiting.
doctor. Okay, doctor, good approach, but let me tell you, you have to go in a more organized way. There was nothing such thing left behind. So in the management, you have to explain, and before before giving an investigation plan, so you have to tell the patient about what you call it, this clarification that my aim to detect any active tuberculosis is going on. So early testing and early treatment is mandatory for you and for your child. Is that
Hmm.
okay? Shall we begin? One thing. So then you have to tell
Hmm.
CBC, CRP, ES are not recommended. Again, please, when patient come with a tuberculosis, straight away go with the four parts. Okay. For you, I'm going to start going for screening for all contact. I'm going to do it. That you have to tell at that point. Second thing, you have to tell the patient chest X-ray. I'm going to do for chest X-ray. I'll be checking your Montox or whatever so on. If like say this is a skin test, okay, you have to mention or
Hmm.
IGRA or whatever so on. This is based on scenario to scenario, doctor. It is not related to this scenario again. Yes, you forgot to ask about BCG scar.
Oh, yes.
Okay,
Yes.
BCG scar, BCG for child vaccination. Okay, and for your child, there is since your child has been coughing, so I might refer him after doing this X-ray, and I am going to start medication itself now, and I will be referring your child to the PI specialist. Okay, for the follow-up. This thing you have to tell. Now let's talk about the
Hmm.
management plan for yourself. Let me tell you, I already arranged that X-ray and other thing. So if it is active TB, so then we will be starting the medication. Like say, I have to you have to mention if you are not a pregnant, then I will be starting this medication. If you are pregnant, I will be changing the regime. Okay. Second thing, if a patient is a pregnant, then you have to change the scenario accordingly. Yes, let's talk about your child now. For your child, as your child has been coughing, so I already arranged the X-ray, and we are doing right now, and I'm going to start a medication. But since child is having active issues, so I am going to refer to the pediatric review. Okay, public and health safety support you given very well that you're going to rule out that contact tracing. That is important part. One thing, BCG scar. Second thing, this you have to go in more streamlined way. So examiner should know that what you're going to do first about the patient, second about the child and his close contacts, and then work related and other thing. So for that one, you have to tell I'm going to activate or I'm going to inform the public health department or communicable diseases. Okay, so you can mention this way.
Okay.
Yes, doctor. So your next case is
And Dr. Imran,
yes,
regarding the
doctor.
contact tracing, we can mention once your results will be positive, only then when we can do the contact tracing in the school or any workplace.
Yes, doctor.
Not before that, right?
Yes, not before that one.
Okay.
Okay, so sorry, I'm also having cough. Okay, doctor, your next case is where is the case? Okay, doctor, now your next patient is a 45 years old male. Come to discuss about what about school giving contact symptoms. All will have cases. No, doctor, we are going to trace that one. We are going to tell in this way that I'm going to write a letter for public health. So they will be looking after for contact tracing. You should not tell that you're going to do the chest X-ray for all. Okay, 45 years old Mr. Ahmad come to discuss his problem with you. Take proper history, manage the patient, examination not required.
45 years, Mr. Ahmad. Okay.
Yes, doctor, start.
Hello, good afternoon. I'm Dr. Musar. Today is in the clinic. Mr. Ahmad, how may I help you today?
Doctor, I'm tired of this dry cough. Now, it's been 6 weeks, not leaving me at any point, doctor.
Can you please tell me more about your condition?
Doctor, I was all right. I don't have any problem. I don't have any thing. But this cough been 6 weeks. I started. I
Mhm.
don't know. Maybe something I ate wrong. Maybe I'm taking something wrong. I don't know, doctor.
Okay. Do you have shortness of breath with this also?
No, doctor.
Okay. What time of the day you feel the cough most?
Doctor, anytime.
And anything that making it worse?
No, doctor. What's at night actually?
Are you waking up at night because of this?
It's not it is bothering me, but I don't feel anything that I have to wake up all night.
Okay. And what do you feel else with this cough?
I feel annoyed, doctor. I have keep on coughing. People think I'm having COVID.
Mm-hmm. Do you have fever?
No, doctor.
Any chest pain?
No, doctor.
Any burning in the chest?
No, doctor.
Okay. And on weekends, still you feel the same cough?
Yes, doctor, all the time.
Okay. And have you didn't have any sputum with this? Okay. Have you lost your weight recently?
No, doctor.
Okay. And do you have any long-standing illness, Mr. Ahmed?
Uh, doctor, recently I've been diagnosed with high blood pressure, doctor.
Hmm. And are you
Yes, doctor.
what are you taking with this?
Doctor, 2 months ago, I've been diagnosed with this high blood pressure. They started the tablet
Hmm.
Ramipril, doctor. They say that it is
Okay.
safe for the kidneys, doctor.
Okay. Okay. And are you taking it daily?
Yes, doctor.
What time of the day?
Daytime, doctor.
Okay. Apart from this, are you taking any other medication?
Doctor, they given one tablet, this atorvastatin, because my cholesterol was high, 20 mg.
Okay. In your family, anybody has similar condition
No, doctor,
like
my
cough?
father had high blood pressure only, doctor.
Okay. And so, what do you do for living, Mr. Ahmed?
Doctor, I'm a teacher.
Mm-hmm. And whom do you live with at home?
Doctor, I'm living with my wife.
Everything fine at work and home?
Yeah, yes, everything is fine. But doctor, my wife is scared that maybe I have TB.
Did you recently visited somewhere, travel somewhere?
Mm, No, doctor, I from home to school. That's it, doctor.
Mm-hmm. You got into contact with anyone having the TB?
No, doctor.
Okay. So, do you have a smoking habit?
No, doctor.
Do you take alcohol?
No, doctor.
And how's your sleep these days? I know it's disturbed
Doctor,
a bit.
yeah. Other than this one, nothing is there. Everything is fine, doctor.
Okay. Well, what was your last weight according to height?
Doctor, my BMI is 27.
Okay. Um. So, what do you have an idea about your condition?
Doctor, as my wife say that I am having TB, maybe I have TB.
Mhm. Okay. And what's your concern in particular?
Doctor, if I'm having TB, then so what will happen if I will have to take a lot of medications?
Okay, I'll be talking about this. And what's your concern? What do you expect from me today?
Doctor, just tell me, do I have TB?
Okay. Before proceeding, just want to know, do you have any rash on the body?
No, doctor.
Okay, let me sum up, Mr. Ahmad. You are having this shortness of breath, sorry, dry cough, since 6 weeks and mostly at night, and you've been taking this medication Ramipril since 2 months. And apart from this, you're concerned about having the TB, and your wife is scared also. Is that all?
That's it, doctor.
Okay. So further, can I know how much of the this medicine you are taking? How much dose of this medication?
Okay, you're talking about medicine dosage 10 mg.
Yep. Yeah, yeah. Okay. So regarding your cough, as you didn't travel anything anywhere, and you didn't get into contact with the TB,
Hmm.
so and you don't have any chest symptoms right now. Don't no fever, no weight loss. That shows that you don't have TB. Okay.
Oh, really, doctor? Oh, thank you,
Yeah,
doctor.
yeah, because there should be any contact with someone who is already having a TB, but that's not, it's not there, right?
Okay, okay.
So basically, you don't have to worry about having the TB, and it's a good news that. But yeah, there is a cause of your cough right now at night that you started your medication for high blood pressure. It's a Ramipril medication, okay? And
Oh,
sometimes it has a side effect of having this cough at night, okay?
oh, okay, doctor.
Okay, I just want to know how much is your blood pressure these days? Did you check recently?
Doctor, my blood pressure is, after taking the medication, it becomes now 138 by 85.
Okay, that's great. And how's your diet these days? Like, are you trying to control your salt levels and junk food if you had any previously?
Doctor, I am trying my best because I don't want to take the medication for
Mhm.
longer. So I just wanted to control my weight. So I'm doing everything,
Mhm.
whatever possible. So, doctor, you told me
Okay.
that I have this problem because of this medication. So, are you going to do anything, doctor, with the medication?
Yes, I am changing your medication right now.
Hmm.
Even though your blood pressure is controlled on it because of the side effect, I need to change it on the tablet Valsartan. Is that okay with you?
No, okay, doctor, that's fine. But where it will be fine for my blood pressure, doctor?
Yes, it will be perfectly fine. It is the alternative of this medication. If you develop any side effect, we switch to this medication. Okay?
Okay, doctor.
And this medication
So,
doesn't have the side effect you're having right now. Your cough will be resolved as soon as you stop the medication. Okay?
okay, doctor. So, doctor,
And
can you tell me?
meanwhile, hmm,
Yeah, doctor, can you tell me how to reduce my weight?
yes, I'm going to tell you that. Just want to know, have you went for any recent investigation for your baseline, like your kidney function, liver function? Have you gone through that?
No, doctor, I just gone through long ago. On the basis of that one, doctor
Hmm.
started the medication.
Yeah, so you didn't go for any annual checkups?
No, doctor, I wanted to go for it.
Okay, so I'm writing the baseline to check your liver, check your kidneys, okay? And I will also refer you for your eye checkup. At the end of session, I will be doing your to check your back of the eye also, just to see if there is an we need to check its annual protocol.
Mm-hmm.
And for your exercise, please try to have an exercise of 30 minutes a day, daily for a week, or 75 minutes of heavy exercise in a week, okay?
Mm-hmm.
And meanwhile, try to reduce your salt. Don't put extra salt on your food. No junk food, and try to decrease your oily food intake. And if you eat, please try to eat 2 hours before your sleep, and have enough rest and sleep. And try to reduce your stress if you have any. But along with that, your blood pressure will be controlled, and this medication will affect apart from that also.
Okay,
Okay.
doctor.
So
Okay,
is there
doctor. So
anything
how
else you are concerned about?
how many months it will take, doctor, to reduce my weight?
Yeah, nice question. So for the next 3 months, even though you are taking this statin medication, I will be checking your lipid profile. And for next 3 months, please try to reduce at least 5% of your weight. It will um uh, put a drastic change in your health, and you will see you will feel the change by yourself.
Mm-hmm.
And
Okay, doctor.
meanwhile, that's all. If you need to know anything, please let me know.
Okay, doctor. Thank you, doctor.
Are you happy that your wife will be not scared anymore that you don't have TB?
Yeah, doctor, that will be big relief for me. Thank you, doctor.
Okay, thank you for visiting me.
Welcome. Okay, well done, doctor. I don't have to add much. Sometime cases might come this way, so you don't have to do much. Only the thing you must be more focused on the taking the history. That will give you a lot of idea. So I am not going to waste the time on this one because everyone got the idea. So we'll be going to Dr. Nimra Wasim.
Yes, doctor.
Okay, Dr. Nimra, your patient is 18 years old. Mr. Talal, come to discuss his problem with you, take proper history and manage the patient. Examination is gray. Means like if it is needed, go ahead. Otherwise, just
Oh,
it's up to your practice. Okay. Okay, doctor, start. Okay, doctor, now start.
okay. Hello, good day. My name is Dr. Imran. I'm your GP today. How can I help you, Mr. Talal?
Doctor, I'm just tired of this cough, doctor. It's been now 8 weeks now. My cough is not getting better.
Hello.
Doctor, I'm tired of my cough actually. It's been 8 weeks now.
Mm-hmm. Okay, can you tell me something more, Mr. Talal?
Doctor, now it is bit improving, but important thing, doctor, I'm trying. I'm just tired of this cough, and I can't sit in the public. People think that I am having COVID, and it's been it's troubling me since 8 weeks now.
Mm-hmm. Okay. Okay, Mr. Talal, can I ask you a few questions about your problem?
Please go ahead, doctor.
Okay, please tell me, do you have any phlegm in the cup?
No, doctor.
Okay, it's a dry cup. And
Yes,
do
doctor.
you have any fever?
No, doctor. I had a fever almost 3 months ago, doctor.
Okay, do you know do you have any treatment for it?
Yeah, I went to the doctor. He said that I have upper respiratory tract infection. He treated me, given some
Mm-hmm.
medication. After that, I was well done. Well, but this cough is,
Mm-hmm. Okay,
troubling me, doctor.
okay. Okay, Mr. Talal, do you have any weight history of weight loss?
No, doctor.
Okay, do you have any chest pain?
No, doctor.
When you cough, do you become short of breath?
No, doctor.
Okay. And can you tell me at what time you have the cough most of the time, most of the day?
Doctor, start anytime.
Okay. And what about your sleep? Are you able to sleep with this?
Doctor, I do get this cough syrup and then I sleep. It's much better.
Okay. Okay. So tell me, are you using any medicine apart from this cough syrup?
No, doctor, I'm just taking this cough syrup with ivy leaves and this tulasi.
Mm-hmm. Okay. So you are able to sleep then. Okay.
Yeah, it is
And
much better,
tell,
doctor.
okay. Okay, Mr. Talal, tell me, what do you do for your living?
Doctor, I'm a student.
Okay. With whom do you live at home?
Doctor, living with my parents.
Okay. And everything good at home and school?
Yes, doctor.
Okay. Mr. Talal, do you smoke?
No, doctor.
Okay, that's great. And do you use any fun drug?
No, doctor.
Okay. And tell me about, do you involved in some sport activity?
Yes, doctor, I'm a basketball player.
Okay. And and how is your how are you playing nowadays because you are coughing? Is it impacting you?
That's tricky question, doctor. Again, well, I'm depressed on that one. You touch my nerves, doctor. Um,
Okay.
Now I don't
Yes.
practice, doctor. Unfortunately, I'm not. I'm out of the tournament because of this.
Okay. Okay. So how is your mood now?
I'm okay, doctor. I'm okay. I'm preparing for myself next tournament, doctor.
Okay, that's good. That's good. And please tell me, Mr. What is crossing your mind? What it can be?
Well, doctor, I hope so. It will not be TB.
Okay, sure. And what is your main worry today?
Doctor, my worry that one. Just I'm hoping it should not be TB.
Mm-hmm. Okay. And what do you expect from me? How can I help you today, Mr. Talal?
Doctor, can you tell me what's going on with me?
Yes, sure. I'm here to help you. You told me that this has impacted you. You are out of the tournament. Any other effect that this caused you?
No, doctor.
Okay, Mr. Tara, let me summarize you. You told me so far that you have this cough from the last 8 weeks. Before that, you have suffered from upper respiratory tract infection, and you are concerned that it might be TB. Anything else you want to add in that?
No, doctor, that's it, doctor.
Okay, may I examine you, Mr. Italal?
Okay, what you want to examine, doctor?
Okay, I just take your vitals, I do general physical examination, and I will auscultate your chest. I will listen to your chest, your heart and your lungs, apex, bases, and back of the chest. I also palpate your lymph nodes of the neck and any pedal edema.
Hmm.
Okay, that's all.
Okay, examination normal.
Okay, Mr. Talal. From your history and examination, I come to the conclusion that you are not, it is just a post-viral cough. And sometimes maybe you have 3 months back, you have the upper respiratory tract infection, and it may be a viral infection. And after that, you are having this cough. So it is most probably related to the to this viral infection. Sometimes the post-viral cough may takes more than 2 months to recover. Okay, are you understanding me?
Mm-hmm. Mm-hmm.
Yes. Okay, Mr. Tilal, it's not like TB. You have no symptoms of TB, no fever, no weight loss, and there is no nothing serious uh, symptoms you are having. So most it seems to me like it is a post-viral cough. Okay, Mr. Tilal.
Okay, doctor.
Okay. And for the confirmation, if you want some investigation, then we will get your full blood count and chest X-ray done. Okay.
Okay, doctor. So why you do,
Okay.
doctor,
Now,
investigation, doctor?
just for the confirmation of the diagnosis, if there is any abnormality in this and that. Okay.
Mm-hmm. Okay, doctor.
Okay. Okay.
So
And what about your diet? Are you taking a good diet?
yes, doctor, I am taking good diet.
Okay, okay. And if it's okay, then if you are disturbed with the cough, you can use a mask for a few days if there is any trigger uh, in your surroundings. Like, if
Mm-hmm.
are you allergic to some smoking or anything else like this?
No, doctor, I'm doing good, doctor.
Okay, that's great. Okay, Mr. Jalal, anything else you want to ask for me?
No, doctor, that's it, doctor.
Okay, thank you.
Thank you, doctor. Dr. Nimra, you did whole case very well, but exam management, you should not say any investigation. The reason, since you reassured the
Mm-hmm,
patient, there is reassurance
mm-hmm,
needed only, and this is a post-viral cough.
mm-hmm,
This one we call overutilization or of the resources. So examiner don't like this thing
mm-hmm.
again. Okay, so
Okay.
since we belongs to the country, third world countries, so there this kind of things
Mm-hmm,
not recommended. Okay, so as per the protocol, you should
mm-hmm,
make sure that patient already had history and patient say it is improving. So it is improving means that there is nothing such to
mm-hmm,
be done. Okay, so you have to talk more about his
mm-hmm,
reassurance. You have to tell this is a kind of suppose infectious cough can last up to 8 weeks. Symptomatic treatment already you're taking this one. I'll be getting one syrup for you that you can use some honey
mm-hmm,
fluid, some Linctus syrups, and possibly some trials of
mm-hmm,
inhaled bronchodilator. If patient comes with, in this not in this scenario, comes with that you can use for short-term bronchodilator or a
mm-hmm,
steroid if patient having wheezy or asthmatic features are there. Otherwise, nothing to add in this case. Okay.
mm-hmm.
So, doctor, your next
Mm-hmm.
case is 63 years old Mr. Yusuf. Come to discuss his problem with you. Take proper history, examination, and manage the patient. Okay. 63 years old Mr. Yusuf. Start.
Hello, good day. My name is Dr. Nimra. I'm your GP today. How can I help you, Mr. Yusuf?
Doctor, for the past 1 year, I have been getting more and more out of breath when I walk.
Okay, so sorry to hear about this. Can you tell me something more, Mr. Yusuf?
Doctor, initially I was feeling well. Initially on the only on the hills when I was walking. Now on the flat surfaces, like the flat grounds, also after 100 to 200 meters, I feel that short of breath. And I keep on getting this dry
Mm-hmm.
cough. I don't have any sputum, I don't have any blood, but I don't know what's wrong with me, doctor.
Mm-hmm. Okay, so sorry to hear about that, Mr. Yusuf. Okay, can I ask you a few questions about your problem?
Yes, doctor, go ahead.
Okay, you told me that you have a shortness of breath from the last 1 year. Do you have any chest pain?
No, doctor.
Okay, and you told me that there is also a cough, but it is only dry cough.
Yes,
Is that
doctor.
so?
Yes, doctor.
Okay. Okay. And which make you to cough this when you walk or at rest you also have the cough?
Doctor, at work most of the time, I feel that short of breath and bit
Mm-hmm.
chest tightness also when I exert myself.
Mm-hmm. Okay. Okay, Mr. Yusuf, tell me, do you have any problem with your any long strand? Do you have any long standing problem with your lungs?
No, doctor, I am taking other medication, but I don't have any problem.
Mm-hmm. Can you tell me which medications are you taking?
Doctor, I'm taking high blood pressure medicine and the cholesterol medicine, like say, taking amlodipine 5 mg and atorvastatin 20 mg, doctor.
Okay, so you are suffering from high blood pressure.
Yes, doctor, it's been 10 years now.
Okay, okay. And are you taking your BP medicines regularly?
Yes, doctor.
Okay. Do you have any heart problem in the past?
No, doctor.
Okay. Any family history of heart disease?
No, doctor.
Any lung diseases?
No, doctor.
Okay. And tell me about your, what do you do for your living, Mr. Yusuf?
Doctor, I'm having shop in industrial area.
In an industrial area. Okay.
Yes,
What
doctor.
kind of shop you are running?
Doctor, I'm having this grocery shop, and
Mm-hmm.
but surrounding me, a lot of metal dust is there, and because glass factories and this iron steel mills are there, so I'm a
Mm-hmm.
bit annoyed because of that one also.
Okay, okay, Mr. Yusuf, I can understand it's very difficult for you. And with whom do you live at home?
Doctor, I'm living alone because I'm living out of the town, so in the industrial area, in
Mm-hmm.
one sharing accommodation.
Okay. And you are sharing an accommodation. And is it a well ventilated room in which you are
Yes,
living?
doctor. Yes, doctor, it is well ventilated. As
Okay.
I told you, this is the industrial area, so again, dust is all around.
Mm. Okay, okay. And do you smoke, Mr. Yusuf?
I used to smoke 20 years ago, and I smoked almost 20 years, doctor.
Okay. And now you have quit smoking?
It's been 20 years, doctor. I quit smoking.
Okay, that's very good. Great that you have quitted smoking. And tell me about what is crossing your mind, what it can be, Mr. Yusuf?
Well, doctor, I thought it was I was getting old, but it seems worse than my friends, doctor.
Okay, okay. And what is your main worry today?
Just I'm worried about it might be something serious like a cancerous. I was here. I
Mm-hmm.
was just listening on the radio. They said it can be the
Mm-hmm.
fibrosis something.
Yes, yes. Yes, we can talk about this. Can you tell me what do you expect from me? How can I help you?
Doctor, I want some proper test to check about my lungs.
Okay, sure. I'm there to help you. Okay, Mr. Yusuf, you told me that you have this shortness of breath and cough. How badly this has impacted you?
Doctor, I have to struggle with staircase and stop half the way, and my independence also reduced now. Social activities I can't go.
Yes, yes, it's very disturbing for you, and you are living alone also. Okay, Mr. Yusuf, let me summarize you. You have told me so far that you have shortness of breath and cough, dry cough from the last 1 year, and
Mhm.
you think that it can be cancer, and you want me to do some tests. Anything else you want to add in it?
No, doctor, that's it, doctor.
Okay. I want to, may I examine you, Mr. Yusuf?
Go ahead, examination.
Okay. I will first sterilize my hand with the alcohol and then Please come on the couch. I will take your vitals, do general physical examination, and auscultate, listen to your chest. Okay. I will check the vital, BP, pulse, temperature, oxygen saturation. Then I will check the eyes for pallor, jaundice, and please open your mouth, say ah, and I will palpate your lymph nodes of the neck. And please lie down on the couch. I will just listen, palpate the apex beat and peristernal heave. Then I will listen your heart, all the four areas. Then I will listen to your lungs, bases, apex, and back of the chest. Okay, and then check the any lower limb edema. That's all.
Okay, saturation is 95%, the rest, and while walking, drop to 91%. Heart rate is 88, and respiratory rate is 20. Hand scrubbing present, just bibasal fine and inspiratory crackles, and no wheezing, no peripheral edema. That's it, doctor.
Mhm. Okay, Mr. Yusuf, it's better that we will do some investigation to confirm my diagnosis. What do you think about it?
Okay, doctor. What
Okay, as you are
investigation, doctor?
also want, yes, I want to do checks X-ray test, and I want to do the spirometry. Okay.
Spirometry, doctor? You available at
Yes.
clinic? You have at clinic, doctor?
No, no, not at the clinic. We will send you for the investigation center.
Any doctor?
Okay.
Anything else, doctor?
Okay. I will check the
Any,
peak expiratory flow rate
okay,
and
anything else, doctor?
and CBC, CRP, and
Mhm.
I will just
Okay,
just
doctor.
this. I will HR. Yes.
Okay, chest X-ray shows reduced lung volume, bibasal reticular shadowing, spirometry pending, and that's it, doctor.
Okay. Okay, Mr. Yusuf, from your history and examination, I come to the conclusion that you are suffering from a kind of disease like interstitial lung disease. Do you know
Is it
anything
cancer, doctor?
about it?
Doctor, doctor, is it cancer?
No, it is not. No, it is not cancer, and it is not like cancer, but it is a progressive disease because you are saying that you are living in a industrial area and there is a smoke and metallic dust. So most probably this is causing it. Are you getting my point, Mr. Yusuf?
Okay, doctor.
Yes, for its treatment, there are some. It is a progressive disease, but there are some treatment available that decreases the symptoms. Okay. So it's better that we will send you to the specialist, and he will do some
Doctor,
investigation like
doctor, which specialist?
to the respiratory physician. Okay,
Mhm.
okay,
Okay,
and he will
doctor.
do your HRCT, and he will do give you some inhalers and like salbutamol as per needed, and inhale corticosteroids. Okay, okay,
Mhm.
Mr. Dalal, Yusuf, are you getting my point?
Yes, doctor. Time up.
Okay, thank you.
Dr. Nimra, well done, doctor. You catch the case because the case can come whether patient is working in that industry or whether patient is working in industrial areas. But you have to know about the exposure area, exposure thing. Okay, first thing. Second thing, in this patient, you should not say that you're going to do spirometry. You're going to do the chest X-ray
Mhm.
and the PFR, and you're sending this patient to the specialist. Nothing extra, doctor. And in your at your level only these two tests needed, rest HRCT or transfer factor
Mhm.
or ANA, whatever, so on, it will be done by the specialist, not by you. Okay, so Dr. Iram
Dr.
Yasir.
Imran, Dr.
Yes,
Imran,
doctor.
not occupational medicine like yesterday we discussed
Doctor,
because
he's
of.
not yeah, you have to send respiratory because he's having lung issues, doctor. Directly is a pulmonologist.
Okay,
Mhm.
doctor.
Okay, because his profession is not impacting, no, doctor, it is outside, external.
Mhm. His exposure.
Yeah, his exposure. He's exposed to something. Okay. So Dr.
Okay,
Iram
but
Yasir.
if any coal or any specific industry is mentioned, then we will refer to the occupational medicine.
Yes, doctor. For example, this patient is working in a glass industry, sandpaper, or patient working in a steel mill where there are a lot of dust is there, some other chemical which is needed. Yes, and best thing
Then the
she
form
asked
of
about any
narrative.
drug history. Okay, best thing she asked about the drug history. That is more important. Okay, some drugs also can cause this what you call it this impact on
Interstitial lung disease.
yes, exactly. So there are a lot of drugs are there. So you have to ask about methotrexate, amiodarone, or vilumycin, or some. There is one more or two drugs are there. So whatever, just you remember, just you can remember the names and you can tell that accordingly. Okay. So Dr. Aram Yasir, so your
Okay,
case
sir.
is Mr. Rahman.
Mr. Aman?
Rahman, Mr. Rahman. Okay, Mr. Rahman, he is a 37 years old gentleman. Come to discuss his problem with you. Take proper history, manage the patient. This is the exam scenario, real exam scenario,
Examination
doctor.
is today.
Sorry, doctor. Examination
Examination
is
is today.
required, doctor.
Okay, required.
Examination required, but this is the exam scenario I'm telling you.
Okay,
Okay, go
doctor.
ahead.
Hello, Mr. Rahman. I'm Dr. Iram. How can I help you?
Doctor, I was fine about a year after treatment, but for last 2 months, my cough is back.
Okay, sorry to hear about this. Can you tell me more?
Doctor, this is like a similar cough, chronic cough problems, and I got blood also, night sweats, and weight loss again started, doctor.
Okay. You told me that 1 year back you had this similar problem and you got treated. Can you tell me
Hmm.
what was your problem before?
Doctor, I was diagnosed with tuberculosis.
Okay. And you were treated for that?
Yes, I got treated. I took the tablet for 6 months, but last month sometime I forgot the doses
Okay.
when I was working at a night shift. So that's the reason I forgot. That's it, doctor. Otherwise, I took medicine properly. But last month was the issue. I missed some medication, doctor.
Okay. And now for the past 1 month, you said that you started having symptoms again. Am I correct?
Last 2 months, doctor.
Last 2 months, you started having symptoms again. So
Hmm.
you feel that these are the similar symptoms that were present before.
Yes, doctor, I do believe that for this is same thing I got it back again.
Okay. Okay, so you have cough
Yes,
and
doctor, I do have cough. I have
blood is
blood
coming
inside
out
my
there.
cough. I am sweating
Okay.
again. I lost my weight.
Mhm. Okay, so sorry to hear about this, Mr. Rahman. Mr. Rahman, I would like to ask you a few questions. Can I proceed?
Sure, doctor.
So you told me that you took complete 6 months medicine last time.
Yeah, doctor.
Okay, first 4 months, first 2 months you followed the four medicines.
Yes, doctor, I followed the four medicine, then two medicine, but last month I forgot the doses.
You forgot. Okay, so may I ask that did you do the sputum cultures in between the tests were done, like first
No,
month, then 2 months?
doctor, I came to this city today. I'm living very
Mm-hmm.
far away from here. So it's very difficult for me to come up.
Okay. Mr. Rahman, I want to just clarify that when you completed 6 month course, did you do one test, sputum test again to confirm that you are treated, or you couldn't do
No,
it?
no, I couldn't do it, doctor.
Okay, you couldn't do it. Okay. And were you following any dot at that time, last time when you were taking your medicine?
Doctor, what is this dot?
Was somebody checking that you are taking your medicine or helping you not to forget? Somebody
No,
from
doctor,
the TB
no.
clinic?
Doctor, who will come to my village far most village, doctor?
Okay, okay. Okay, Mr. Rahman, may I ask, do you have any history of, I'm going to ask some personal question, please don't mind, okay? So
Mhm.
do you have any history of HIV?
No, doctor.
Okay. And have you been ever tested for that?
Never, doctor.
Never. Okay. And do you smoke?
Uh, yes, doctor, I do smoke.
Okay. How many cigarettes a day?
Doctor, I do smoke 20 cigarettes daily.
Have you ever thought of quitting smoking?
Doctor, I tried, but I am unfortunately can't do it.
Okay. Mr. Rahman, see, it's you're having a difficult time again because of your lung problem. So I'm going to help you for this. If you cannot decrease, you cannot stop. At least try to decrease the number of cigarettes, and we'll have a separate discussion for this. Is that okay, Mr. Rahman? I can help you with this.
Thank you, doctor. Just
Okay.
please do it for me.
Okay, sure, sure. We will. I will enroll you in the smoking cessation clinic, and we will also have a separate session for that. Mr. Rahman, what do you do?
Doctor, I'm working in that village factory, doctor. This is a
Village
kind of, gold mining factory.
gold mining factory. Okay. And who is at home with you?
I'm not living in home, doctor. I'm living in the same accommodation. Is that old accommodation crowded? People are
Okay.
living around.
People are living. Okay, I can see. And how often you visit your family? Are you seeing your family back
It's
home?
been 1 year. It's been 1 year, doctor. I haven't seen them, doctor.
Okay, you must be very missing them. I can understand it's a challenging job, Mr. Rahman. And in the
Mhm.
dormitory, do you find anyone else coughing like you?
Yes, doctor. One fellow having very bad cough. It's been months and months. I was keep on saying him that to go to the doctor. He's not going to the doctor.
Okay. And when you were having the problem, was it notified at your place that you are having this problem? Did your
Uh, they
doctor take?
wrote they wrote one letter to that company, and some people
Okay.
came and they tested, and after that, I don't
Okay.
know.
That was great. Okay. Okay, Mr. Rahman, other than this, do you have any other past history, like any high blood sugars?
No, doctor.
Do you take any regular medicine on basis?
No, doctor.
Okay. So, Mr. Rahman, what's crossing your mind?
I think it came back again. The tuberculosis.
Hmm. Yeah, yeah, I can see that this is your must be your concern. And are you able to work? How is it affecting now this time?
Doctor, I keep on coughing. I can't concentrate. My work is very
Mhm.
precise to
Mhm.
filter the gold.
Yes, I can understand. It's a challenging job. I'm here to help you, Mr. Rahman. And what's your utmost worry?
I'm worried that this time drug will not work on me.
Okay, we'll work on it. Okay, I'm going to help you for that. Don't worry. And in what way you want me to help you today, other than treating your problem? Any particular
Doc,
expectation?
doctor, I want some proper test. I just want anything. How to complete my
Sure, sure.
this treatment, doctor.
Okay, okay, Mr. Rahman. So far, you told me that you are having cough and shortness of breath and this fever for past 2 months. You are a known case of tuberculosis. Last year, you took the treatment, but somehow you were not compliant in the end, and you are worried that this is back again, and you want to have some definite test to find out and what is the proper way so that it's treated properly. That's all,
Yes,
Mr.
doctor.
Rahman.
Yes, yes,
Mr.
doctor.
Rahman, I would like to examine you.
Okay, doctor. What
Please,
you want to examine?
in the presence of full privacy, I would like to undress you. Let me take your vitals and check your general physical examination. I will check your eyes. Show me your hands. I will check your nails also. And I will take your weight also. And let me tap your chest. Okay. I will look at your general appearance and will tap the chest on the front and for the back. And will also listen to the lungs and your heart as well. I will check your tummy and look for the skin for any rash.
Okay. Temperature 37.9, respiratory rate 18, blood pressure normal, saturation 95 on room air, thin, mildly cachectic patient, reduced breath sound, and crackles in right
Mhm.
upper zone. No clubbing, no peripheral edema, lymph nodes, bilateral, tender cervical nodes,
Okay, Mr.
palpable.
Rahman, it's like I'm so sorry. Yes, as you were concerned and you were afraid, I'm afraid that this TB is not it looks like again you are having the problem of tuberculosis, but looks like it was not treated the first time. But anyways, we are going to find out. We'll do the repeat the X-rays and we'll compare the X-ray from the older X-rays as well that were present 1 year ago. Are you getting me?
Okay, doctor.
Okay, you have your reports with you, the previous ones. Okay,
Yes, doctor. So
okay.
chest X-ray showing new cavitating lesions and progressive fibrosis. Sputum AFB again positive.
Mm-hmm. Okay.
And what else, doctor?
Doctor, Mr. Rahman, I would like to send the sputum for PCR as well as rifampicin resistance test as well. And then we will start
Pending.
you on the same medication that we gave you before. But this time, we'll start the medicines rifampicin, isoniazid, moxifloxacin, and pyrazinamide, along with the pyridoxine. And you will take it for 2 months, and then next 2 months you will take continue with the three medicines, except moxifloxacin you will keep continue all. This time this is very important. As I asked you before, I'm going to enroll you to the TB clinic as well as a directly observed therapy, in which somebody will come from the as per our local guidelines. We will check, and I will make sure that somebody comes and help you take your medicines so that you don't forget it. Are you getting me?
Okay,
Okay.
doctor.
And I'm going to notify your dormitory area where so that they give you a separate place so that you are not spreading the infection to others. Isolate for 2 weeks, 2 weeks, and wear the mask. And only when we repeat the sputum after 2 weeks, then you will be able to continue your
Time
job
up.
again. Okay.
Time up.
Yes.
Okay, Dr. Ram, well done. Nothing left untouched again. You have this agenda of this case to how to recognize that patient relapse. That was a most important agenda. And the best thing you ask about anyone is coughing. Okay, so that was the tricky question over here. And you capture in a way that examiner was forced to give you okay, pass. Okay, so Dr. Amna Khan is here.
Thank you, doctor.
Thank you, doctor.
Yes, doctor.
Dr. Amna, your patient is 54 years old, Mr. Noor Muhammad, come to discuss his problem with you. Sorry, not Mr. Noor Muhammad. This is Mrs. Noor, sorry, doctor. Mrs. Noor, come to discuss her problem with you. Take proper history and manage the patient. Examination is required, doctor. Okay, start.
Hello, Mrs. Noor. I'm Dr. Amna. How may I help you today?
Doctor, doctor, I'm feeling unwell. It's been 5 days, doctor. I'm having this cold and I'm having worse cough actually. I try a lot of medication, but not getting better, doctor.
Okay, Mrs. Noor, I can understand you are going through tough time, but can you tell me more about your tiredness and cough?
Doctor, it's been 5 days. I told you that I started fever, now rigors and feeling shivery. And I'm feeling that there is a sharp pain on my right side of chest when I take deep breath or cough, doctor.
Hmm. Okay. You told me about the fever. Have you checked the fever? Did you record it?
Yeah, doctor, on the thermometer at my home, it was showing 101.
It's quite high grade. Do you have chills as well?
Yes, doctor, I feel chills and rigors both.
Mm-hmm. Is it throughout the day or there is particular time of this fever?
Doctor, I'm taking this paracetamol tablet. It is coming down again, comes up. So it is not leaving me, doctor, at all.
Okay, Mrs. No, you told about cough. Is it dry or it is with the phlegm?
Doctor, it's now productive, thick yellow green sputum, doctor.
Okay, thick green sputum. Okay. And the pain that you talked about on the left side of your chest, can you describe what kind of pain is this?
Doctor, it's sharp pain.
Does it go anywhere?
No, doctor.
If I give you a score of 1 to 10, 1 is the least and 10 is the intense pain, how will you score your pain?
Doctor, when I'm breathing in, when I am just moving, so it is giving me, yeah, like say when I'm taking deep breath, I cough sometimes. It's giving me some sort of sharp intensity, like say 6 to 7, doctor.
Okay. All right. Any shortness of breath?
Yes, I do get breathlessness when I'm walking across the room.
Okay. Any night sweats?
And no, doctor.
Mhm. Okay. And let me ask you a few questions. Have you noticed any blood in your sputum?
No, doctor.
Okay. May I know how is your appetite these days?
Doctor, I can't eat because I feel bitter taste in my mouth.
Mm, okay. By the way, any sore throat?
No, doctor.
Okay. Mrs. Noor, are you diagnosed with any long-standing illness in the past?
Doctor, I am having diabetes and high blood pressure.
May I know what medications you are on?
I'm taking this metformin 1,002 times daily and amlodipine 10 mg.
Do you take your medication on regular basis?
Yes, doctor, I do.
Okay, that's very nice, Mrs. Noor. Do you monitor your blood pressures?
Yes, doctor, my blood pressure is under control and I do take care of my blood pressure. Weekly, two times I'm taking my blood pressure. Once at rest, once after doing some exercise.
Okay, it's highly appreciable, Mrs. Noor. What about your blood sugar? Did you check your recent HbA1c?
Yeah, doctor, my HbA1c always 6.7, 6.8, doctor.
Okay, and when did you had your last HbA1c checked?
Doctor, last 2 months ago.
2 months ago. Okay. Mrs. Noor, anyone in the family has same problem like you have, like cough or fever?
No, doctor. My grandson, he is only 3 months ago, or 3 months old. He
Mm-hmm.
had a fever.
Okay, he had fever. Okay. So how is he doing now? Did you get him some medicines? Did you
Yeah, doctor, he's
get him
fine.
checked? All
He's
right,
fine,
that's
doctor.
nice. Okay. Other than your blood pressure and high sugar medicine, any other medication that you take?
No, doctor.
Okay. I'll be asking few personal questions, Mrs. Noor. Would that be okay for you?
No, doctor.
When was your last menstrual period?
Doctor, don't have medicine now, doctor. 4 years.
Okay. Okay. And uh, any blood from down below?
No, doctor.
Okay. Do you smoke?
No, doctor.
Do you consume alcohol?
No, doctor.
Any allergies, including medicine?
No, doctor.
Okay. Mrs. Noor, what do you do for your living?
Doctor, I'm retired principal.
Okay. And you told me you have a grandson at home. Who else lives with you?
Me and my daughter.
Mm-hmm. Okay. And all right. Mrs. Noor, any idea what is causing this cough and fever?
I think I have a chest infection, doctor.
Mm-hmm. Okay. By the way, did you had any recent travel to some
No,
other
doctor.
country?
No,
Okay.
doctor.
Any okay. Any particular concerns you have regarding this?
I'm worried that maybe I have a pneumonia-like condition. I need hospital admission.
Okay, I'll come back to this point. And what do you expect from me today?
I'm hoping for antibiotic, doctor.
All right. And how this cough and fever has affected your life so far in past 5 days?
Doctor, I can't take care of my grandson, and my wife, my
Mm-hmm.
daughter is working.
Okay. Let me summarize what you said, Mrs. Noor. You came today with this complaint of fever and left-sided chest pain and cough for past 5 days. You are concerned it might be pneumonia, which needs hospital admission and some antibiotics. Is that all?
Mm-hmm. Yeah,
Can I
doctor.
examine you, please? Can I examine you?
Okay, okay, doctor.
Yes, I will sanitize my hands in the presence of complete privacy. I will check your pulse, blood pressure, temperature, your respiratory rate, and O2 saturation. I will have a look on your hands. I will look at your mouth and eyes and lumps and bumps in your neck. Please lie down. I will tap on your chest, both sides, and I will listen to your chest. And please get up. I will tap on back of your chest, and I will listen to the back of your chest as well. And at the end, I will see any swelling in your legs, in your feet. All right. Okay.
Anything else,
Yes.
doctor?
Anything else? Mm, I will check. Yes, I will have your peak expiratory flow rate reading as well.
Okay. Temperature 38, your respiratory rate 22, heart rate is 105, blood pressure normal, saturation 94 on room air, generally appear unwell but alert and oriented. Chest expansion reduced and bronchial breathing with ghost crackles in right lower zone. No peripheral edema and no other problem.
Doctor, can you repeat the respiratory rate?
The respiratory rate is 22.
Okay, Mrs. Noor, based on what you told me and the examination that I did on you, I suspect you have a condition we call pneumonia, the infection that you are also thinking about.
Okay,
Okay, but
doctor.
Mrs. Noor, to confirm my diagnosis, I just want to run few investigations. Would that be okay for you?
Okay, doctor, what investigation?
Yes, I would like you to do your full blood count, your ESR, CRP, your X-ray
Mhm.
chest, and your sputum for culture and sensitivity.
Okay, chest X-ray shows right lower lobe consolidation. Blood shows WBC is 18 and neutrophil count is 95, CRP is 110.
Okay, Mrs. Noor, so these investigations support my diagnosis. You have pneumonia. So let's discuss about measurements. Let me address your concern. Since you are telling me you are concerned for hospital admission, I just want to reassure you. You do not need a hospital admission at this moment, I believe. I will give you some medicine, some antibiotics, and some lifestyle measures. Hopefully, your condition will better. Okay. Regarding the medication, Mrs. Noor, how about if we start you on tablet amoxicillin, 500 milligram twice a day? You will take it for 5 days. Is that
Mm-hmm.
okay?
Mm-hmm.
And yes, and along with this, yes, you are 53. And yes, along with this, I'm giving you tablet paracetamol, 500 milligram thrice a day. You will also use this. All right. And how about Mrs. Noor for your cup? If you take some steam, like a plain water steam, will also help you relieve your cough and your congestion as well. And
Okay.
Mrs. Noor, in your condition, how about if you take some lukewarm water, add some spoon or 2 spoons of honey, and drink it? This will also help you smooth your throat and help you overcome your cough as well.
Okay, doctor.
Yes, and Mrs. Noor, I just want to tell you that this cough will take some time to cover, right? It will take some weeks. So just relax and try to take your medicine on time. Take some home remedies. If you have humidifier at home, that will also work
Mm-hmm.
best in your condition.
Mm-hmm.
Okay, and
Okay, doctor.
yes, I will see you. I want to see you after 48 hours just to make sure that you are going good with the medicine and these remedies.
Okay, doctor. So, doctor, what kind
Okay,
of pneumonia I have?
you have a typical pneumonia, like community acquired pneumonia, you can say.
Okay, doctor.
Yes,
Mm-hmm.
and regarding your son, your grandson, since you told me that you have taken him to the doctor, that's good. If he's checked by the doctor, that's good.
Okay, well done, Dr. Amna. What was the CRP score for this patient?
Yes, she was not confused. She was normally talking to me. Okay, urea,
Mm-hmm.
perhaps you did not give me respiratory
No, no,
was not.
doctor. Urea is not for a GP level. We have only
Okay.
CRB, not curve.
Yes. So CRB doctor, she was not 65 year age. She was 53. So let's cut it down. Blood pressure was normal. She
You
wasn't
have to add,
confused.
you have to address when you are examining, doing the management. I'll be doing assessment through my CRB 65 scoring. Okay. I'll be checking the
Okay.
severity. You have to address this when you are doing examination. Examiners want to listen this thing that how you are going to manage the patient. Okay. Otherwise, there is no such thing any loophole left, so I don't have to comment much. Dr. Ghulam Nabi is there.
Okay, doctor.
Dr. Ghulam Nabi.
Dr. Muni, Imran,
No,
Dr. Imran.
Dr. Imran. Yes, doctor.
Sorry, Dr. Imran. As you said, we have to verbalize CARB criteria 65, right?
No, you should not
Uh,
verbalize. We have to tell I will be checking your severity on the basis of our scoring system
mhm.
CRB 65. Don't say CURB, okay? So this is a plus point in your exam.
Okay, and we can tell the patient that since you have mild to moderate pneumonia, and at this point you
No.
don't need
You cannot tell
admission.
mild or no, doctor. You don't tell mild to moderate. You have community acquired pneumonia. That's it, doctor. You should have a general. If you're telling mild to moderate, then you have to go a little bit more further, and patient will eat you over there. SP will eat you.
Since the patient is asking for admission, so you can say at this point you don't need admission.
Yes,
You can
exactly.
see.
Because you are suffering from the pneumonia, which is treatable with the medication at home.
All right.
Yes, you should not say mild and moderate. Okay, you're taking mild and moderate means you're putting some words in the patient mouth, and patient will again bite you.
All right.
Dr. Ghulam Nabi, ready?
Yes, Dr.
Doctor,
Imran.
Yes, doctor.
Dr. Imran,
Yeah, doctor.
I'm sorry to interrupt you. This
Yeah,
Dr.
doctor.
Imran case, was it treatment failure or recurrence of the TB?
Sorry, doctor. This is a relapse of the TB or recurrent TB. Okay, there was two agendas was there, but patient one person is coughing over there. So the thing you have to test that patient also to screen out that patient also whether he's also having TB and he's living in the same dormitory where he was there before the diagnosis of the tuberculosis first time.
Okay.
Okay, doctor. Anything else, doctor?
No, so in case of treatment failure, the sputum will not be negative in between the treatment.
No, doctor, this is a relapse. Relapse means like he got a relapse because there is one person is coughing in his room.
So he got it again from that
Yes,
person.
yes, doctor.
Okay, okay.
Okay. So,
Thank
Dr.
you.
Ghulam Nabi, yeah, thank you, doctor. Dr. Ghulam Nabi, your patient is 25 years old, Mr. Yasir, come to discuss his problem with you, take proper history, and manage the patient.
Okay. Examination is gray.
Examination is required, doctor.
Okay. I didn't listen. Okay.
You know.
Mr. Yasir, 25 years.
Yes, doctor.
Okay. Hello, Mr. Yasir. I am Dr. Ghulam Nabi. How may I help you?
Doctor, I'm having this dry cough. It's really worsened, and I can't sleep because of this cough, doctor.
Okay. Can you tell me more about your condition, please?
I've been suffering from this cough almost 6 months now, and keep on disturbing me over at the night, most of the night, doctor. Not night, but most of the night.
Mm-hmm. Most of the night. Okay. Okay. Can you tell me this cough uh, is have any phlegm or dry cough?
No, doctor, it's a dry cough.
It's a dry cough. Now it's 6 months. Okay. Do you have any fever with that?
No, doctor.
Most of the time, the cough comes in night or all the day?
No, at night, doctor.
At night. Okay. Okay. Do you feel chest pain on when you're coughing up?
No, doctor.
No. Do you feel short of breath?
No, doctor.
Okay. Uh, do you have any long-term illness?
No, doctor.
No. Okay. Are you taking any long-term medication, daily basis, I mean to say?
No, doctor.
Nothing.
I'm just taking this. There is one syrup for my indigestion, doctor. This Gaviscon.
Okay, it's gone. Okay. Okay. So I want to ask you a few more questions which is related to your condition. Is that okay with you?
No, doctor.
Okay. So just tell me, what do you do for living?
Doctor, I'm a software engineer.
Okay. To whom you live with?
I'm living with my friend.
Friends. Okay. So how's about at home? Do anyone have the same cough in your environment in at home? I mean to say,
No, doctor.
nobody. Okay.
No, doctor.
The work area is okay. There is no any stress. I hope so.
Doctor, I have to stay for late for to project on the project, doctor. So
Okay.
stress is going on,
Mhm.
doctor.
Okay. What type of work you are doing there in engineering, as you are telling me?
Um, Doctor, I'm a software engineer.
Okay, software engineer. Okay, okay. So, do you smoke, Mr. Yasir?
Yes, doctor.
How many cigarettes per day?
Occasionally, doctor, one or two cigarette, doctor.
1 to 2 cigarettes. Okay. Since how long?
Mm, it's been 5 years, doctor.
Okay, I'm giving you the leaflet. If you are just read it out, the hazards and If you are ready to quit smoking, we will make another session and I will help out to you. Okay?
Sure, doctor.
Are you consume alcohol?
No, doctor.
Any party drugs?
No, doctor.
What about your exercise also?
Doctor, I seldomly go for exercise because I don't get time.
Don't get your time. Okay. Okay.
Hmm.
This cough is disturb you in sleep, as you told me, if I'm not
Yes, doctor.
wrong. Okay.
Yes, doctor.
And anything else in the sleep disturbances except this cough?
Doctor, I get some burning chest pain also.
Okay. Is mostly it's occurs when you eating and going to sleep?
Of course, doctor.
Okay, okay, okay. So, okay, Mr. Yasir, uh, do you have an idea what's going on with you?
Doctor, maybe I'm suffering from some lung infection.
Lung infection. Okay. So, what concerns you have?
I'm worried
What
maybe I'm
worries?
doctor, worried maybe I'm having TB.
TB. Okay. Okay. So, what do you expect from me?
Doctor, can you do some test for me?
Okay. Okay. So, is this condition impacted in your life except the sleep and other things?
No, doctor, it is impacting my work also because nighttime I can't
Well,
sleep that day, other day, so I can't work properly, doctor.
okay, Mr. Yasser, just now summarizing as you are telling me that you have a cough most of the time, last 6 months.
Yeah.
Okay, you are working as an engineer and software engineer, and during only the night you have cough, and you are thinking that maybe there is there's chest infection in your
Mm-hmm.
chest also. And,
Mm-hmm.
I forget that uh, expectation also. Okay,
Okay, doctor.
so may I examine you, please?
Okay, doctor, go ahead.
Okay, I'll do the general physical exam. I will check your pulse, respiration. I'll check your hands also. I will check your eyes for anemia and any pallor. I will check your throat and nose also, and I will check your lumps and bumps in the neck also. Can you remove the shirt? Come on the couch, please. Thank you. And I will see and touch and listen through my stethoscope. I will see any swelling or any scar mark, and I will percuss on the front and the back of the your chest also. I will listen the four areas of the heart sound and also the vocal resonance front and back, and
Mm-hmm.
that's it, and the lower limb edema.
Examination normal. BMI is 37.
Okay, BMI is 47. Okay,
37, 30.
okay, 37. Okay, so Mr. Yasser, as I got all your data, it looks like that your cough is induced to your by after eating. It's called gastroesophageal reflux disease, GERD.
Okay.
Mm. So, do you have any idea what's going on? What
You
is
mean to
that?
say you mean to say my stomach is the problem?
Yes, actually, if you are eating and then you are sleeping, so that's your food pipe, that the bag of your stomach, the food pipe will regurgitate, and then you feel the burning sensation, and that burning sensation irritate on your throat. So that is the reason to cough. It will comes. Okay, are you
Okay.
getting me? Okay,
Okay, doctor.
so I am advising you to a few things to do it. When first of all you frequent small meals. You have to reduce the first of all reduce the weight. Do the
Mm-hmm.
daily 30 minutes walk, and take
Uh-huh.
less carbohydrate. Don't eat too much
Mm-hmm.
outside, and
Mm-hmm.
take the protein diet also, and take fruit
Mm-hmm.
most of the time. And when you take the frequent small meals,
Okay,
small meals, okay.
okay,
And
doctor.
when you lie down to high pillow, try to make your sleep in little bit high pillow, so in the in last meals, try to be 2 hours before to going to bed for sleep.
Okay,
Are you with
doctor.
me, Mr. Yasir?
I got
Okay.
it, doctor.
And did you ever not using, you are using only Gaviscon syrup as you told me, which I remembered.
Yes,
Okay.
doctor.
So what we will do, we will start the PPIs, proton pump inhibitor, like esomeprazole, okay, for for 1 month, okay,
Okay, doctor. Okay,
and you
doctor.
just take this regime, and then which
How to take,
I
doctor?
it's before meal, okay,
Okay. How long
once a
before
day.
meal?
It's 30 minutes before,
Okay, doctor.
okay. And try to be what the things I'm telling you that you have to do, it will be good for you, okay. You
Okay,
have any
doctor.
questions to me?
No, doctor. Thank you, doctor.
Okay, thank you.
Thank you.
Dr. Imran, you couldn't put my time, so
Time
that's why I
timer is with me. Google timer. Okay. I just was looking at that one because I'm using two timers. Okay. So, doctor, you used 11 minutes, but I wanted to listen from you what management you're giving. Management was very well done, but Dr. Lamnabi, you took a lot of time in history taking. History is very straight away case. Okay. This case again was the exam case. Okay,
thank you,
doctors,
doctor.
thank you. Yeah, thank you, doctors, everyone. Today we completed 10 cases. Tomorrow we'll be going to day 8 cases. So day 8 cases, I will be giving chances to different care doctors. Okay, again,
Dr.
and I will
Imran,
be,
one
yeah,
thing,
doctor.
if you get a time now, you are run away, then just send me the voice message, which I missed it, first of all. Second thing, in this case, we can give the any cough
Okay,
syrup.
I know, no, I know. I will give you. I will tell you now itself, but for everyone. Okay. First of all, doctor, when patient come with a dry cough, no, young patient with any problem, and you have to tell him what time you get the cough. If he is saying night time, and when you're getting lying down, lying flat. Okay. Second thing, whether do you have any other problem along with the cough? He will be telling you, doctor, I'm having heartburn. You didn't ask. You asked in a very late way. Okay, that's the reason you are keep on dragging the history. So patient will tell, doctor, I'm having heartburn, I'm having acid regurgitation, and I feel bitter taste in my mouth, especially at the night. Then sometime the case scenario will come like this, doctor, I have a dry cough, but I am having the problem. I am having
Mhm.
hoarseness of voice. Okay. I have to keep on cleaning my throat, like say, kind of stuff. So this is quite
Mhm.
annoying for me. Scenario can come
Mhm.
like this. Fourth scenario
Mhm.
will come in a way, doctor, I am having this chest pain. What kind of chest pain? Where is the chest pain? Doctor, I am having a central chest pain. So what kind of that pain? Doctor, I'm having burning chest pain. Do you have
Mhm.
rashes? No, doctor, I don't have the rashes. So
Mhm.
this is the fourth scenario. Fifth scenario,
Mhm.
let me tell you one more. Doctor, I
Mhm.
started this some medication.
Dr. Imran, I'm
So,
sorry to jump in. Can I ask something in between? You just
yeah, doctor,
mentioned
please.
Aresh,
Yeah.
why we are, what's the significance of
Doctor, rash
Reshi?
means like say, yes, patient having chest pain. For example,
Okay.
he said that the chest pain, it can be shingles, doctor. This be herpes, something. Okay,
Yes,
so we have to rule out
burning sensation and
burning,
cough.
burning session chest pain. Okay, now patient
Yeah.
told having burning chest pain. So it is inside or outside. To rule out that one, we have to ask about rashes. So means we are going to cover two way. That I asked about differential also, and I asked about red flag also. I asked about patient HOPI also.
Can we also ask, is it substernal or epigastric above the sternum, or?
First of all, we should not use any kind of medical jargon. We have to tell where is the pain above the chest, above the bone, below the bone, okay, in the
Okay.
muscles, in between the rib cage. So patient will tell you. Don't use a substernal, sternal. This you're telling this will be jargons, doctor.
The bone, okay, chest bone
Yes,
or sternum. Oh,
yes, doctor.
oh,
Okay.
fine.
And doctor, fifth scenario will come with some medication patient is taking. Just now I had one case with AC inhibitors. Okay. So patient might come with some sort of medication, maybe DMRD. Okay. Patient is a known case of some sort of rheumatoid arthritis patient is on the medication and started newly, and patient can come with that chest pain and burning sensation. Okay, so we have to rule out this one. And yes, of course, patient is a chronic hypothyroid patient. Patient is taking early morning empty stomach medication. Patient is keeping the long gap between the between the meals and the medication, 1.5 hours. It might trigger. Okay. Third scenario will come, doctor, I am having a bad breath in my mouth. So we have to go with halitosis, but along with that one, we have to rule out GERD, gastroesophageal reflux. Okay. Sixth scenario, sixth scenario. Okay, now sixth or seventh scenario. Okay, sorry, I forget a number. That will come. The patient, doctor, I'm having burning pain also, and I'm having burping also. Now here, one of the case I got here, I think Dr. Mavish was the one doctor, and she asked the question that doctor whether this is the how it will be dyspepsia or something. Sometimes patient will come with dyspepsia and gastroesophageal reflux disease. So we have to tell you have the problem with gastroesophageal reflux disease with dyspepsia. Okay, so this is a combined scenario. In that scenario, we are going to start. Going to start the medication. Same time, we are going to take the H. pylori. But if patient involvement only with esophagus, we are not going to test for H. pylori. We are giving the trial of treatment of the PPI, not getting better. Then we will stop the medication for 15 days. Then we will be doing. So that can be the scenario. Fifth scenario, oh sorry, seventh, eighth scenario will come in a way that patient might experience, just simply he will be saying, doctor, he will not say anything till you dig out. Doctor, I am feeling very annoying, doctor. I keep on burping. Okay, since how long you're burping? Doctor, it's been ages now. May I know what's your weight according to height? BMI is high. Okay, so what kind of diet you're taking, late night eating habit, whatever. So do you have any chest pain or something? Yes, doctor. Patient can come with a cough, burping, burning sensation. Patient come with medication or usage. We can with anything. Okay, I've given you 8 or 10 scenarios. So for this case, whatever we have gone through, I've given you 8 to 10 scenarios. So now 8 to 10 scenarios, nothing will come more than that one from in the exam. I can assure you. The reason because these are the commonest scenarios being tested in the exam throughout the years. Okay, so this was the Dr. Ghulam Nabi, and let's talk about examination. Examination is required only the gray. If it is not written over there, examination not required. Still is the gray, so you have to perform the examination, chest examination, abdominal, only upper abdomen examination with general palpation. But when you're doing the examination, please look at patient face. Okay, and Dr. Amna, for your case, you did the chest expansion. Please don't forget to do the chest expansion, doctor. And what I was forgetting. Okay, and the management outline, Dr. Ghulam Nabi rightly said, I don't have to add anything. Any question, any query, doctor? Please ask me. Then I have to time.
Dr.
Yes,
Imran, I have
doctor.
a question.
Yes,
In a
doctor.
patient of ILD, can we temporarily give salbutamol for his shortness of breath or
Doctor, first
steroid?
of all, yes, doctor, first of all, you have seen the patient already, the patient X-ray. So you have already ruled out. So there is not, that is not our domain. So this straight away, this patient is specialist case, we're going to refer it immediately.
All right. Okay.
Yes, doctor. Anything else, doctors? And
Yes, doctor,
for the
referral
exam,
will be 2 weeks on referral will be 2 weeks criteria, na? ILD.
ILD, but patient is having severe problem, like say he can't walk 100, 200, 200 meter. Doctor, it's severe, no?
Mm-hmm.
Based on
Okay.
severity. Because
And
Okay.
his profession also involved, no? Here, sorry, not profession. His occupation. He cannot do his daily work. He's getting very difficulty walking around.
Mm-hmm.
okay.
Yes, doctor.
And if it's 2 weeks referral, then we may give salbutamol or something
We
to
can give for
relieve
short term.
temporary.
We can give short term relief, doctor.
Okay, thank
Okay.
Okay, doctor. So there was one question in earlier session when started the session when doctor asked about examination. So doctor, there are two patterns of examinations are there. One, what we can arrange in a way that we will be giving you 2 minutes and to verbalize the examination. At same time, there is no need to on the video. Keep the pillow with you. and while verbalizing the exam, you have to perform on the pillow. Is that okay for you? Because that one we can use as a hybrid module to teach you guys. Is it okay for you guys? Keep the pillow while
Yes,
doing the
doctor.
test. Yeah, so it will be, doctor, easy and more accurate way what I'm getting from you, from everyone, because now everyone is living in a different time zone, different areas, and different countries. So it is not easy for everyone to perform the cases and to go for the videos. What I can do it, we can arrange 1 or 2 sessions on that we will be doing examinations. My most common examinations, like say system wise, uh, the condition is that one everyone should have the pillow with them. Okay, one doctor is going to perform within 2 minutes. Okay, everyone will get the chance. Whoever is a participant, everyone will get the chance for one examination or two examination based on the attendance. Is that okay for you guys?
Yes, Dr.
Yes,
Imran.
doctor.
Okay, sir.
Okay, so okay, better to keep the pillow, and it will be easy for you to get the muscle memory. Okay, now also again, I was during the one, I was thinking on that I have to tell you guys, when you are sitting with you, that you have to keep one pillow with you and do examination when you are performing the case. It will be easy again. Okay, so thank you very much, doctor. See you guys inshallah tomorrow.
Thank you, Dr. Imran. Thank you.
Thank you,
The
doctor.
same time.
Thank you, sir.
Thank you,
Same
Dr.
time, huh,
Imran.
Dr. Imran?
Yes, yes, doctor.